Doctor? Pharmacist? Doctor? Pharmacist?
Larry David goes to fill his dad's blood thinner prescription, only to have his enthusiasm curbed by a pharmacist recommending an alternative. So what was this MacGuffin of a blood thinner? When people say blood thinner, they usually mean either something that affects platelets binding to blood vessels or something that interferes with the body's clotting cascade, which are two different things. Since the latter group has a more serious bleed risk, no one just rips off a new prescription without talking to a patient about it. So the medication is likely part of that first group, an aspirin equivalent, which is an antiplatelet drug. For antiplatelet agents, there are a handful of options, but because this is Season 5, Episode 4 of the hit series, which aired on October 16th, 2005, some of these drugs had not yet been released, and some were not recent enough to warrant a doctor, or pharmacist in this case, suggesting funky, fresh, new alternatives. There's no animosity between doctors and pharmacists, especially in a hospital setting. Pharmacists are always checking dosings and interactions, and are super helpful in more nuanced cases like transplant. Clopidogrel started being used in stroke prevention around the new millennium with the Capri trial. Silostazol came out in 1999 for claudication or leg pain from lack of blood flow, often during exercise. Aspirin and dipyramidol as a combination comes out in 2002 for stroke prevention. Triflusil became recommended for stroke prevention after 2003, but is not frequently used in the United States. The GP2B3A inhibitors like tirofiban, eptifibatide, and epsiximab are usually used right before a heart catheterization and very rarely afterwards, so it's not likely to be that kind of medication. I think the most likely prescription was a switch from aspirin to aspirin plus dipyramidol, or maybe just clopidogrel. But based on the show, Larry should probably focus on his blood pressure, which is definitely through the roof.